Now we bring in a frontline hero, Lauren Schiller, a COVID ward nurse at the University of Florida Health in Jacksonville. Lauren, thanks so much for being with us.
Hi, thank you for having me.
Well, there you are, right in the COVID hotspot, really at the center of what we're seeing right now. What's your ward like at this moment? Describe to us what you're experiencing.
It is very busy right now. We have a total of 32 patients, where 2.5 weeks ago we had 26. So it's a lot more people, a lot busier. We have 2 people in a lot of rooms, so we're no longer private rooms, we're double rooms now. So that's back to where we were last January in our big peak of last year. So we're kind of taking a step back to where we were and trying to navigate through this new variant and help as many people as we can. And it's very busy here.
Are you able to tell us how many of those people have been vaccinated or not?
Majority of the people that are in the hospital have not been vaccinated. I believe it's in the upper 90% of people who haven't been vaccinated that are currently in the hospital.
Wow.
But I am proud to announce that we have began to give the vaccinations on the floor to people who are here on our care before we're about to send them home. We actually had one patient today that was able to leave with the vaccine, one of the first doses. So that's a really cool new thing that we're able to do. And we're just hoping to get more and more people vaccinated, as many as possible.
Boy, if that's not just a real life message right there, the fact that these folks you are seeing are not vaccinated. Did they want to be vaccinated? Has it been hard to convince them that now they're in the hospital sick, that they definitely should? Have they been, okay, I get it now, I'll be vaccinated?
Yes. I would say once they get to the point where they're in the hospital, almost all of them say they want to be vaccinated now, that they wish they had gotten vaccinated before it got to the point where they had to come to the hospital. There's very many people that where they get discharged, they say the first thing I'm going to do when I leave here is go and get vaccinated. So that's something that we hope reaches out to a lot of people who haven't been vaccinated yet, to try to get them to get out and go get vaccinated before they have to get to the point where they come to the hospital.
Well, I hope this sends a message, our interview, that people pay attention. You know, you've worked through earlier COVID surges, and many of us thought that this summer would mark the beginning of the end to the pandemic. What do you think of that optimism now?
I wanted to be optimistic too. I would have loved for all of this to be over, but we can't always get what we want, and we just have to roll with the punches and learn more from every day and try to better ourselves and better the care that we can give people, and, reframe our minds into maybe we need to wait longer to open things back up and continue to wear masks, continue to social distance, don't take anything for granted, and just be smart. And soon enough, I'm sure we'll be able to go back to normalcy again.
Love your positive attitude. You know, your state's governor, Ron DeSantis, signed an executive order today, Lauren, allowing parents to choose whether or not their kids will mask up at school. And he says his own kids aren't even going to wear masks, which is against current CDC recommendations. So the executive order actually says, quote, masking children may lead to negative health and societal ramifications. What do you think of that messaging?
I think it's interesting. I can see that side of it. But, as a nurse, it's not for any of us here to really make decisions for other people. Everybody has to make their own decisions. We can only give our opinion and what we know from our studies and the information that we're given from doctors and scientists here. So it's up to the public to try to make their decisions based on the information they have. And we hope that we're giving them information that they choose to, recognize and put into their daily lives as practice. So that's really all we can do.
So I wonder if the governor would consider visiting your ward, or maybe he has. I bet you would have a message for him.
He hasn't been one to come yet, but, who knows? we're welcome to opening our doors to people who are able to get a message out, and we just want everyone to stay safe. And I do think that coming here would open a lot of eyes and help some people into coming to terms with what this actually could mean for them, and just go get vaccinated.
Well said. Lauren Schiller, we sure appreciate you not only for doing this interview, but for who you are and what you are doing right there on the front lines. Important work. We appreciate you so much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.